this is the only non-communicable disease that is actually increasing in premature mortality so much as 5% since year 2000, so meaning dying before 70 years of age, that there is a need to address the diabetes treatment gap, but also the gap to control. So even if you are lucky enough to have a diagnosis, and if you have got some treatment, we see that many are still uncovered by the treatment and many more are not controlled.
It really depends almost on your postal code, what kind of quality of care you receive as a person with diabetes. I think it's completely unacceptable. Is that there's a huge gap between guidelines and clinical practice, and even worse, even bigger gap between guidelines and the achieved clinical outcomes.
There's a lot of good work happening on diabetes, but we need to come together. We need to speak with the same voice. And I think we need now to really utilize the data we have, create the data we need, and action upon them. It's no need to have data that is orphaned. We need to turn that into action on the ground.
And this committee should be involved not only in the creation, but also in the maintenance and the governance. This committee needs to ensure the involvement and buy-in from all the stakeholders and also be an integral part of a healthcare system, such that the data will drive change in care where it's deemed necessary. And the results and the indicators on the registry should be accessible for learning and research purposes. The diabetes registry is not a nice to have, it is an integral part of the integrated care model, allowing for accountability and also providing the required information to change care where it's needed in order to achieve better control.
It's also important that the authorities are in line with what the healthcare providers at the floor are doing. Use clinical relevant data that clinicians recognize and are eager to look at, but also decision makers, patient organizations, for instance, other stakeholders. It inspires discussions on how to improve.
Compare yourself with other centers to see what are they doing better, where am I doing pretty good, where can I learn something from somebody else, and where maybe I could serve as an example for another center. Sometimes it's important also to look at the trend in your own center to see whether the ideas, the changes that you have undergone are actually successful or not.
But building these infrastructure takes a lot of effort.
Of course, a high quality registry doesn't come for free, so there needs to be an economic incentive to maintain this registry, to make sure that it is sustained over time.
Too many registries have appeared and then disappeared as financing dwindled out.
New regulation on EU health data space. And this is definitely the crucial piece of legislation that will be working. We cannot harmonize healthcare standards, but we can remove obstacles that exist. And of course, the biggest obstacles that exist currently is the lack of interoperability between data between different member states.
So of course, we would like to introduce, in the kind of framework and establish the rules and procedures, interoperability and data quality, and of course, give the legal base for the reuse of health data.
This really should appeal to the interest of the different actors in the health ecosystem. And that's the reason why it needs to be tailored. Of course, there are a lot of people who are a bit wary and anxious for registries. For people with diabetes, it will be important to clearly understand that their data will contribute to a better care.
We need to include the patients. And this is really the next step. We have done great initiatives of trying to involve patients, but we really need to get the patient voice into our registry much more.
We have the digital diabetes questionnaire to capture patient-reported outcome and experience measures. And we can discuss at the visit both how the person is feeling, general well-being, managing diabetes, and also how the person experienced support from diabetes care. So this hopefully can support patients both in raising questions with clinicians and become more involved in self-management.
The winds are changing, and this is great to see.
I don't think we can ask people to enter their data manually anymore. And this also should ensure a higher quality of data collection. For primary care physicians, they need definitely an incentive to participate.
We believe we really should bring digital health to the 21st century. And when we say digital health, we mean also digital data automatization. Digitalization is the only way we can increase the quality and access to data.
One thing that really improved outcomes, particularly intermediate outcomes, and some of the harder intermediate outcomes, was pay for performance.
This will require some more technology, and one recommendation that was added recently is to establish a unique identifier for patients in order to link different registries.
Access to data in digital format, interoperability, and finally tools infrastructure, including the apps, the access to smartphones and to the personal data space, and of course, availability of patients to provide data to the providers.
We hope that the future advocacy will point in the direction that it's important to sustain the existing initiatives and join them instead of creating new registries.
Having access to the same kind of data that the person facing me in the doctor's office is so important. Can you remember when first CGM systems were coming to market, they were blinded for the person living with diabetes? I mean, how crazy was that? Because for me, it was the game changer altogether to see my own data every 5 minutes and see how that affected me.
I really can't function without my computer system now with the data. So when a patient comes in, I bring up the person with diabetes who's in front of me. Straight away, it tells me how many prescriptions the patient's picked up or when that patient picked up the prescription. So if our prescriptions are monthly and I see that they haven't picked it up for a couple of months, I can see that there may be an issue with adherence.
The use of large data sets and registries provide enormous opportunities for diabetes research. However, it's not so much where we can use the data in diabetes for, but rather where do we need it? And there are so many questions that currently are still unanswered in research, where diabetes provides us with where data provides us with a fantastic tool. Everything that we do needs to look at data for personalized treatments. We need to be better at tailoring the care that we're offering to people with diabetes and make sure that what we offer them is suitable, sustainable, and is also what they need and want.
So we believe that registries are necessary to complement the results of randomized controlled trials and provide additional insights on effectiveness and safety of our medicines in real-life clinical practice. All these points will result in faster drug development and approval and will improve the value of our medicines for patients, providers, and society.
Benefits for the healthcare system, benefits for HCPs, for doctors, for nurses, for, these are benefits that ultimately will benefit people like me.
I think everybody who spoke clearly indicated that registries have added value. But everybody said they're not enough. You need to do something on top of it. You need to have quality circles to improve your care with the data that you find in the registries. You shouldn't reinvent registries, but try and harmonize them. You should also include, for instance, patient-related outcomes in all of the registries.
You need ambitious targets, and those centers who had the most ambitious targets appear to be also those who are reaching the best average glycemic control.
And now 2020, that the red part of very high risk HbA1c levels are actually getting smaller and smaller and smaller, which is very encouraging.
If you take it seriously, if you implement a data registry system, which is an integral part of the healthcare system, you can achieve outcomes if you have a concerted action around these data. Let's use these data also for accountability.
Another very important message you gave was you need to have the buy-in of all stakeholders. Well, I think we heard clinicians, we heard people living with diabetes, we heard industry saying, we support this. So there is buy-in. I think you also confirm to Mr. Sokol and all the other policymakers that diabetes should be on the agenda.